it's Sue here. I just wanted to pop on and do a quick video in our auditory week about sound sensitivity. Sometimes we have referrals for children that have developed a really specific sound sensitivity. It's not exclusive to sound, but it can happen in sound quite often. And I think the most common one that I have come across is the sound of other people chewing. That the child develops a super sensitivity to the sound of other people chewing around them, and it's very disruptive. They might separate themselves for meals. It becomes a friction point for the whole family when the other family members feel blamed for chewing too loudly or lip smacking or those kinds of sounds. So I just wanted to give you one hint with that. I know there are people watching probably outside of driving distance to one of our CATS locations. I think OT can be a real help in this situation, but the approach is really two-pronged. So that's what I wanted to tell you is if you have an OT that is also doing some work on the child's thoughts and the child's thinking, so has maybe some CBT training, or just using that kind of an approach without a full-blown CBT treatment qualification, that would be great. Then you're handling both those. You need to sort of understand the sensory system, and you need to understand the CBT thought process system, how that plays into it. If you have an OT that doesn't really have that background, because not all of us do, then I would maybe look for a counselor or a therapist that could add that piece for you. And if you have a counselor or therapist that is doing that side of things, you might want to add an OT to look at the sensory side. Okay, those are my hints for that. Please be in touch if we can help you out with that issue. It is tricky.